This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And good morning, and thanks so much for joining us today on Columbus Concerns. We have a couple of guests with us today to talk about the 988 Suicide and Crisis Lifeline. With us is Sue Valillo, the Vice President of Clinical Services and Provider Relations at Adam H. And Allie O'Donnell is here. She is the 988 and Suicide Prevention Services Director at North Central Mental Health Services. And I'd like to thank you both for being here today.
Thank you for having us and giving this opportunity to talk about 988.
Well, Sue, first of all, you're with Adam H. Talk a little bit about what it is you do.
I'd be happy to. So the Adam H. Board of Franklin County is the Alcohol, Drug, and Mental Health Board. We are one of 50 boards throughout the state of Ohio. We are responsible for planning, evaluating, and funding behavioral health services throughout the community. My role there is to work with the funded partners in the community to ensure that they are providing high-quality, cost-effective services.
And Allie, tell us a little bit about what you do with the 988 and Suicide Prevention Services over at North Central Mental Health Services.
Sure. So I am in charge of our 988 and Suicide Prevention program over at North Central. So I run the 988 program for, which is the primary 988 program for the county of Franklin, for Franklin County. And over there, we have a team of about 25 staff. We are 24/7, so a full-time operation. And we are actually very unique in terms of 988 centers because we also have a blended staff. We have paid staff and volunteers. So we have a really, really amazing team over there, and I'm really blessed to get to run that program.
Sue, tell us a little bit about the relationship between Adam H. and North Central Mental Health Services and how you facilitate what they do at 988.
So the relationship between the two organizations is the Adam H. Board is responsible for planning, funding, and evaluation. We don't provide direct services to individuals. We do that through a network of community-based service providers, including North Central Mental Health. So we are a funder for North Central Mental Health Services. We are a partner in community work with them. And Allie and I have been working together on 988 since Allie came to North Central Mental Health, really trying to expand awareness in the community, work with other community partners to direct them towards this line, and maybe most importantly, work with our 911 call centers to educate them about the services and work towards some ability to transfer calls as appropriate.
Allie, tell us a little bit about 988. If somebody calls 988, what happens?
Great question. And I get this question a lot, especially because people, when they think about reaching out for help, it's really scary. That's a really vulnerable thing to do. So people do want to know, what does it look like when I call 988 from the moment that I dial the number? To start, when you call 988, you will hear sort of an automated message from the 988 system just telling you that somebody will be ready to connect with you. You have a couple of options depending on if you need a specialized line. For example, for veterans, there's a specialized line that can connect them with services directly for veterans. And if you are Spanish speaking, you can speak directly to a crisis professional who can connect you or who can speak Spanish. Otherwise, you can remain on the line, and somebody who is trained in crisis intervention will be happy to connect with you. So once you connect, from the moment we pick up the phone, we are going to be there to listen to you, to hear you. We want to support you. Really, people ask, what can we call 988 about? Anything. If you are struggling, if you just need a listening ear, we want to be there to support you. That is what we care about. We care about you, your crisis. You do not need to be suicidal to call 988. That is a big misconception that we hear a lot. People think they need to be actively suicidal. If you just need someone to talk to, if you're having a bad day, that's what we're here for, and that's what we want. We want to hear from you in those moments.
And it's so interesting, Sue. There's so much talk about a mental health crisis going on in America today and in Central Ohio, and these people are on the front lines.
They are, and the work they do is amazing. They are able to stabilize most crisis situations during the phone call. And so they are able to work with the individual who's calling in, ensure that they are hanging up from that calling, feeling stable, feeling safe, feeling secure, and with some resources to help them move forward. So I think the work that they do is absolutely amazing, particularly in this time where we have, I believe, finally begun to destigmatize mental health, mental illness, mental health needs a little bit in this country. We experience physical health crisis, and no one thinks twice about getting help in those situations. And it is exactly the same thing for a mental health crisis. It doesn't matter what the crisis is. A person needs help. They should be able to get it immediately and easily, and that's what 988 does.
And Allie, I imagine everything that somebody says on 988 is confidential.
Yes, completely confidential, and you do not need to share anything you're not comfortable with, including your name if you don't want to provide that. You can remain anonymous when you call.
Are there ever any times when the folks who take the calls at 988 feel compelled to go a step further and call in authorities, like a call in 911?
Yeah, so unfortunately that does happen on occasion. I will say 99% of the time we are able to resolve the call without involving law enforcement, for example. The only occasion in which we would do that, especially without the caller's consent in doing so, is if there is immediate danger. If they are in the act of suicide, we would call, or if they are currently not safe.
Mm-hmm. Talk a little bit about, Sue, could you tell us just a little bit about, differentiate 988 from 911?
That is an excellent question, and it's another one that we get a lot. So 911 is the number that you call when you need law enforcement or EMS. So if you're having a behavioral health crisis that does not require one of those two very highly trained, specialized people to come out because they will come, to assist you, if you don't need that level of assistance, if there's not immediate danger, if there's not something that you need an immediate physical response to, that's when you can call 988. They can work with the person on the call, resolve the situation, or if it does escalate, they can reach out to 911 as well. So I think Ellie said it really well earlier that the individual making the call gets to define their crisis. We don't know what a behavioral health crisis is for someone. Whatever that person is experiencing that they feel like is a crisis, that is reason enough to call 988. I think the other really exciting thing about 988 is not just getting the person the care that they need when they need it. It also frees up law enforcement, EMS, to go to places where they are actually critically needed. They spend a lot of time going out on behavioral health runs where their very specialized skills aren't particularly the skill that is needed. So being able to divert those calls to 988, get the person the right care they need, and free up our first responders to be able to do the work that they are trained for is just another bonus of 988.
Our guests on the program today talking about the 988 Suicide Prevention and Crisis Lifeline are Sue Valillo. She is the Vice President of Clinical Services and Provider Relations at Adam H. And also Allie O'Donnell is here, the 988 and Suicide Prevention Services Director at North Central Mental Health Services. Allie, let's talk numbers for a moment. When was the 988 line launched, and how many people have you been able to help since then?
That is a great question. 988 was launched 3 years ago, so 2022 in July. So we've been able to help a substantial amount of people since then. I don't have a specific number of exactly how many, but I can tell you that we receive approximately 2,000 calls a month.
Wow.
From 988 alone, yeah.
And you mentioned something interesting earlier about how you have a blended staff. You have some professionals and some volunteers. Talk a little bit about the role of volunteers and how they help out and what kind of training they have to go through.
Sure, I would love that. So actually, North Central Mental Health Services, we've had a suicide prevention hotline for approximately 40 years. So we've been around for a long time doing this work. Up until 2023, when 988 was rolling out, we were entirely volunteer run. So all of our phone lines were being answered by volunteers. So that is our foundation. That's our heart. That's where we come from. They receive the exact same training as a paid staff member would receive. So it's approximately a total of, I think at this point, 60 to 70 hours of training. So it's very intensive. We do a lot of education, of course, plus role plays, plus observing and monitoring. And we really, really take the training very seriously because this is a very serious thing. And we want to make sure that when people do call in, they receive the support that they need and deserve during their hardest moments.
September is Suicide Prevention Month. Sue, talk a little bit about why it's so important to be open and honest and have open conversations about suicide.
So I think there's this false belief, if you will, in the community that if you're concerned about someone, you're fearful that they may be considering suicide, that if you mention it to them, it will cause them to act in that way. We know that that's not true, that that's really just opening a door for someone to be able to talk about what they're experiencing. And the more we're able to talk about it openly and honestly, and particularly with folks on 988 that are well-trained and ready, the more likely we are to save people's lives and to get them the care that they need, whether that is something that's short-term related to a specific incident that they are experiencing, or whether it's some longer-term kind of behavioral health need. Those factors really don't matter. What matters is the ability to talk openly so we can get people the care they need and the time that they need it.
Allie, talk a little bit about who calls 988. Obviously, somebody who's feeling desperate or feeling in trouble can call 988, but how many times do you get like a family member or a support member?
Absolutely. Wonderful question. Anyone and everyone calls 988 and can call 988. We get a lot of family members, friends, co-workers even. We've had employers call, schools call about students. Anybody can call. If you are concerned about anyone's well-being mentally and you're just not sure how to proceed, it's a great idea to call. We can give you guided help. We can get in touch with the person directly. And yeah, anybody can call. If you just need someone to talk to, we want to listen. We want to support you. We want to be there for you.
I guess my next question would be, when somebody calls, how much, your counselors who take the calls, how much of what they do is listening and how much is giving advice?
So ideally, all of it is listening, and we're rarely giving advice. What we want to do is collaborate with the person in crisis. And so what that looks like is allowing them to make their own choices without us making any choices for them, and helping them to kind of come up with solutions on their own, because I think it's so much more empowering and powerful for you to come up with that, with help and with support that we can provide, but we don't want to be pushing you towards anything that, you're not yourself wanting to do.
Sue, working with Adam H., after they talk to somebody, what sort of resources are available to the people who call?
So there's a large network. We have about almost 40 partners in our network that provide behavioral health services throughout the community, dispersed geographically throughout Franklin County, that offer a wide range of services that people can be connected with from 988. I think one of the other key factors with 988 is they can actually dispatch a mobile team if someone is in crisis, not able to resolve that crisis on the phone, we have resources in Franklin County that will actually allow a clinician and a peer to go to where the person is to see if an in-person intervention can help to resolve that crisis.
Allie, how many times do people call and say, I need some help, but I can't afford it. I don't have insurance. I don't know what to do.
We hear that a lot, and we are so fortunate in Franklin County especially because so many of our services are free or they don't require insurance, and we're able to provide that help without costing them a big financial bill.
And Sue, I guess from Adam H., from your perspective, how does that work?
So that is what we fund through our partner agencies. Is we provide funding for, again, about 40 services or 40 providers in the community to provide free care for people who are uninsured, underinsured, don't have some other means to pay for the treatment that they need. So that's a big part of what the Adam H. Board does through our partners like North Central Mental Health.
Our guests on the program today are Sue Valillo, who is the Vice President of Clinical Services and Provider Relations at Adam H., which is the Alcohol, Drug, and Mental Health Board of Franklin County. Also, Allie O'Donnell is with us today, and she is the 988 and Suicide Prevention Services Director for North Central Mental Health Services. Allie, what's the trend when it comes to calls? You said about 2,000 a month. Has that been growing?
Yes. Since we opened our doors and started taking 988 calls, it has continually increased, which is so amazing as more and more, especially Ohioans, are finding out that 988 exists. We're seeing more and more calls. I think back in 2023, we were getting, under 1,000, just a couple hundred calls, and now we are getting 2,000 plus, and we expect that to continue to grow. And it's amazing.
Do you have enough people to take all the calls, or is that always a challenge?
I think staffing everywhere, especially in the mental health field, is always going to be a challenge, but we do have a substantial amount of staff, and with the supplementation of our volunteers as well to help answer those calls, we will do everything we can. Also, we have an incredible network in Ohio for 988 specifically. So if we can't answer the phone for whatever reason at North Central, we do have backup providers who can also answer the calls. We have 19 call centers in the state of Ohio for 988, which is more than any other state. So we work very, very closely together, all 19 centers. So if you cannot be answered by Franklin County for some reason, you will be answered by another Ohioan.
988 was in the news a lot lately because the federal funding for specifically for those who call up from the LGBTQ community was cut. But services are still there for them, right? Absolutely.
Anybody, including the LGBTQ community, can call us, and we will support them as best as we possibly can.
Sue, I wanted to ask you about something. Earlier, before the program started, you mentioned something called the Crisis Care Continuum. What is that?
So we really look at crisis services as a continuum in Franklin County. So the first part of the continuum is 988. Someone's in a crisis. It's very easy to pick up the phone. Again, as Allie said, it could be anonymous, share what's happening. 80% of the time, those calls resolve the crisis. For that other 20% of the time, the next step on the continuum is a mobile crisis intervention. So we are fortunate in Franklin County to have mobile crisis teams that are a clinician and a peer. It does not include law enforcement. That is through NetCare Access that 988 can dispatch. So that 20% of the time where the crisis is not resolved on the call, a mobile team can be dispatched to the individual. Once the mobile team does their work, again, most of the situations that the mobile team responds to, they are able to resolve in the field. If for some reason they are not, the next piece of the continuum then is to elevate care to a higher level, which within weeks will be the new Franklin County Crisis Care Center, and that will be a place where people can go. So it's someone to call, someone to come, and somewhere to go as a continuum of services to help resolve a crisis.
When you look at the nation as a whole, where does Central Ohio stand when it comes to mental health services? Do we have enough?
I would say in many ways we are ahead of other parts of the nation in that we are a very coordinated system of care. Our organizations that are providing services are highly collaborative. There is a very singular focus, I think, in this community, in Franklin County, and I'm going to even expand that out to our law enforcement and 911 call centers, about getting people the right care when they need it. And there's really an effort to ensure that that is what's happening across the community, and it's really exciting to be part of.
Allie, there's been a lot of talk, too, about how mental health problems have been affecting youth in particular. Do you get a lot of young people calling?
We do certainly get some young people who call. I think one of the other amazing things about 988 is you don't have to call, you can text or chat, and I do think that a lot of youth prefer those options. But we do certainly get youth that call.
Looking ahead, what improvement? It sounds like the continuum is the future. Talk a little bit about this center that people can go to.
I would be happy to. We are weeks away from opening a new crisis care facility in Franklin County that will offer a place for people who are in crisis to go 24 hours a day, 7 days a week, to receive in-person services and linkage then to community-based care that they may need. New facility, new service provider, Recovery Innovations International. Because it's a new build, we are not exactly sure of the specific opening date, but it will be within the next couple of weeks.
Fantastic. Allie, talk about, is there one aspect of mental health or one problem that you see a lot with people calling with?
That's hard to narrow down. We have people who call dealing with all kinds of things. I think, depression and anxiety are certainly some of the top things that people struggle with. But we have people who call us about everything. And honestly, and we love that. And we are here for them when they do call, no matter what they're calling about. But I think it's pretty hard to narrow down a specific topic. Yeah.
And if someone calls and they're experiencing a crisis, but drugs and alcohol are contributing to that crisis, where do you send them for help?
Well, I think that entirely depends on the individual who's calling. As I mentioned earlier, our main goal is to collaborate with the caller. So if they have if they're already connected with services, we might look into those avenues that they're already connected with. It might just be something that we can resolve on the phone. It might be something that requires, the continuum of care, the mobile crisis team, or to go to a facility. It just entirely depends on the individual and also what they're wanting, because we always want to honor their wishes.
And Sue, could you talk a little bit about that aspect of it, the alcohol and drug addiction services, and then what's available here in Franklin County?
Yeah, I would be happy to. So I just want to be really clear that if alcohol or drug use are involved in the situation, that should not prevent someone from calling 988. So it doesn't matter if someone is under the influence of substances, none of that matters. There is not a disqualifier at any level for someone to call 988. So I want to make that really clear so that people are aware of that, should that be a need for them. We are really fortunate in Franklin County that we have some exceptional substance use disorder services, and they run a kind of a gamut, if you will, from folks who need maybe some individual counseling to inpatient rehab. We have services such as Mary Haven, Comp Drug, C&D, APDS. We just have a range and a variety of both service providers and services that they offer to meet the unique needs of the individual.
Allie, I'm glad you mentioned earlier about how you have text and chat services available. Is that becoming more popular?
It is. At North Central Mental Health Services, we actually are not the text and chat providers for Franklin County. So that is actually through NetCare, who is our partner in 988 and in many other things in the community. So they run the text and chats for Franklin County. And from what I understand, it continues to grow just as much as the calls.
And it's the same sort of services, the same kind. You can ask them the same sort of questions.
Absolutely. It should be exactly the same, yeah.
Well, we're just about out of time, so I'd like to thank you both for being here on the program today. Our guests have been Sue Valillo, the Vice President of Clinical Services and Provider Relations at ADAM-H, which is the Alcohol, Drug, and Mental Health Board of Franklin County. Also, Allie O'Donnell has been with us. She is the 988 and Suicide Prevention Services Director at North Central Mental Health Services. And just a reminder that September is Suicide Prevention Month, and we'd like to thank you both for being here today and for all the important work that you do. And we're so glad you joined us today on Columbus Concerns. We hope to see you again next week.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
I'm Tiffany Haddish.
And I'm Marlon Wayans. African Americans are 3 times more likely to be diagnosed with pancreatic cancer than any other racial or ethnic group.
When you or someone you love is facing a pancreatic cancer diagnosis, access to cutting-edge treatment can help make long-term survival possible and improve future patient outcomes.
That's why Stand Up to Cancer and the Lustgarten Foundation have teamed up to bring over 30 pancreatic cancer clinical trials to those who need them.
Learning all you can about pancreatic cancer, including treatment options and what clinical trials are available, can give you or a loved one even more than hope. It can help make long-term survival possible.
For more information about the latest pancreatic cancer research and clinical trials near you, visit pancreaticcancercollective.org.
Food. Our survival relies on it. Yet every day in central Ohio, nearly 1 million pounds of it enters the landfill. That's a lot of food, natural resources, and money being wasted. The meals on our plates require a lot of energy, water, and land to grow, harvest, and prepare. And we rely on a healthy planet to provide that. When we choose to throw food away, we're choosing to discard all the resources that were invested along the way, not to mention the money that's being tossed out. But together, we can make choices that make a difference in our community and protect our environment. In fact, there are a lot of small changes that we can each make to reduce our waste, like saving our leftovers, properly storing our food, and composting. Learn more about what you can do to reduce your food waste at home, at work, at school, and in your community at SaveMoreThanFood.org, a program of SWACO.
Are you prepared for an emergency or disaster? Because it's not a matter of if, but when. Don't find yourself saying,
I'll trust water bottles and a flashlight to save the day, but I'll be proved wrong.
With a tornado approaching, I'll realize that I lack a wheelchair-accessible shelter.
When the floodwaters rise, I'll be up in the attic with 20 cans of beans. It's a recipe for disaster.
Let's prepare so we all have a better story to tell. Get started at ready.gov/older adults. Brought to you by FEMA and the Ad Council.
Don't you wish your life came with a warning app?
That dog does not want to be petted.
Well, life doesn't always give you time to change the outcome, but prediabetes does. Take the 1-minute test today at doihaveprediabetes.org. Brought to you by the Ad Council and its Prediabetes Awareness Partners.
Hey, Dad, your prescription will be ready in just a minute. Hey, Dad, your laundry will be ready in just a minute. Dad, your lunch will be ready in just a minute.
Hey, honey, why don't you take a minute? When you help care for a loved one, you give them as much time as you can. But it's just as important to take time for yourself. AARP can help. Find free care guides to support you and your loved one at aarp.org/caregiving. That's aarp.org/caregiving. Brought to you by AARP and the Ad Council.